Welcome guys. So in this video we can see about various teratogens in pregnancy. So first of all I request you to subscribe the channel and click on the bell icon so that my efforts will reach you at the right time. So I have created various playlists in my channel. When you are free, please watch those. They are extremely high yielding. So first we can see about various teratogens in pregnancy. First of all, if a pregnant patient having a seizure disorder or she is taking valproate, phenytoin as a treatment drug, the child will surely develop neural tube defect. So if a woman suffering from seizure disorder is planning for a baby, so 3 months before she should switch over to the drugs like levetiracetam, bevaracetam, lamotrigine with the consultation of a neurophysician. And the next, if she is taking AC inhibitor, the child will have increased possibility of developing renal dysgenesis. And the next is, if she is suffering from bipolar disorder and she is taking a drug called lithium during her pregnancy, the child will have the possibility of getting Epstein anomaly. And the next is, if a doctor unknowingly gives tetracycline without investigating whether she is pregnant or not, the pregnant woman will have the child as soon as born will be suffering from discoloration of teeth and enamel hypoplasia and various other bony anomalies. The next is, if the pregnant woman is having a alcohol addiction, the fetus will be suffering from fetal alcohol syndrome. What are the features of fetal alcohol syndrome? It's nothing but a growth restriction, microcephaly, craniofacial abnormality, the lips will be big. The next is, if the pregnant woman having an acne problem and she visits a dermatologist and the dermatologist, without investigating whether she is pregnant or not, he or she gives a drug called isoretinion, like a cream or a tablet. Her baby will be suffering from microtia or anatia, as well as her baby have the chances of CNS anomaly. The next is, if she is taking a mifepristone or misoprostol, the child will have increased possibility of Mobius syndrome. What will be the important cranial nerve suffering of the Mobius syndrome is 6th cranial nerve. The next is, we have well known the common advice that we will advise the pregnant woman not to bath in hot water. Always we will advise them to bath in lukewarm water or cold water. The reason is, if there is a hyperthermia, there will be an increased possibility of the child having CNS defects or facial defects. The next is, the radiation is extremely hazardous for the baby. So up to certain level the radiation is allowed and it does not causes any fetal anomaly. That is, if the radiation is less than 5 rads, there will be no fetal anomaly. When the radiation is greater than that of 10 rads, there will be an increased possibility of fetal anomaly. So the radiation between 5 to 10 rads, it's always inconclusive. So we must have a repeated follow-up for those patients who are less than that of 10 rads and greater than that of 10 rads. Any radiation exposed woman should have a repeated follow-up with level 2 scan. So the next is, if a pregnant woman having DVT or any other heart defects and she is on a drug with or treatment with warfarin, always change the drug from warfarin to low molecular weight heparin in first trimester itself, because in first trimester itself there is an increased possibility of warfarin embryopathy. Or if she is taking a drug of warfarin greater than that of 5 gram per day, there is an increased possibility of warfarin embryopathy. So the protocol now followed is, As soon as you detect the pregnancy, you must switch over to low molecular weight heparin for up to 12 weeks. After 12 weeks, we can continue warfarin. Up to 36 week, there is a final switch over to low molecular weight heparin at the 36th week. And this low molecular weight heparin should be stopped at the time of anticipated delivery. Yes. Hyperglycemia is nothing but an overhead diabetes. So increased glucose level, which causes free radical injury. The most common anomaly is CVS anomaly. The most common CVS anomaly is ventricular septal defect, that is VSD. So the risk can be easily found out with HbA1c having the value greater than that of 6.5. So increased HbA1c value increased the possibility of having a CVS anomaly. So here comes the important point. The most specific or the most pathognomic sign or anomaly of overhead diabetes or uncontrolled GDM or hyperglycemia is caudal regression syndrome. It is a very important question, repeatedly asked question. So know this point. And that's it, guys. Thank you. Please subscribe the channel. Watch those videos in the playlist.